Okay. Assalamu alaikum and greetings. Positive Impact has started a series of talk with key leaders and people in the industry coming from various walks of life. These sessions will be on how they are responding to COVID-19 pandemic and what sort of preparations are needed. So today we have Dr. Danish Mouhammad Khan with us. He is known for his experience as a clinician, but also as a leader to lead one of the key healthcare settings in Karachi. And also he's running a college called UMDC. He's one of the directors there, and he is known for his leadership and clinical excellence. He is running state-of-art facility. So I would now like to introduce and start session with Dr. Danish. So Dr. Danish, would you give us a little bit about yourself and a little bit brief introduction about yourself so that we can start the formal session? Thank you.
Thank you for inviting me. I am the director of United Medical and Dental College. So we have three hospitals that function within this umbrella: Creek General Hospital, United Hospital, and AO Clinic. These three hospitals have a variety of patient encounters and a variety of different patient populations that come over here. Creek General Hospital, which is our primary teaching hospital, is a free charity hospital with 14 specialities and is a 500-bed hospital, and has a large volume of indigent patients that come over here. We have tried to develop a cost-effective and organized way of trying to tackle the problem of healthcare amongst the non-affording population over here. United Hospital, which is our second hospital, is a private setting and has patients from usually the middle class and upper middle class that are able to afford healthcare, because most of the payments are through out of pocket. Around 15 to 20% are health insurance patients. This is a cardiology center and a nephrology center and specialized eye center. Third hospital is our partner hospital in this institution and is the biggest and the busiest trauma hospital of Karachi, with over 100 patients admitted at one point in time of trauma in this hospital, and around 15 to 20 trauma surgeries done every day. So they are also active members, and now as we have made an association which is called the Private Hospital and Clinics Association, which has all the large hospitals of Karachi and Sindh in it, including Ziauddin South City Hospital, OMI, Liaquat National, and also our hospitals. So AO Clinics directors are also he's the president of this institution, which is directly communicating with the government at this point in time of the corona crisis. So therefore this entire group is therefore I get a lot of information from there.
Great. Okay, so my questions will be really around how you are, how well you are prepared, how you are responding. So the first question I have is, Dr. Danish, what are the key challenges you healthcare settings are facing at the moment in Pakistan to combat with coronavirus?
Sorry, I got disconnected because of the telephone call coming in. Can you just ask the question again, please?
Yeah, sure. So Dr. Danish, what are the key challenges faced by our healthcare settings in this pandemic situation?
Well, the key challenges that I feel, because I am a US trained person, I'd spent the last pandemic that occurred was that of the swine flu in 2009.
Yeah.
And I was a resident at that point in time in the world's largest medical center, the Texas Medical Center. But the mortality rate of the swine flu was not as high as that of corona. At that point in time too, I felt when I was observing systems over there and then looking at our system back home, is that we as physicians are making decisions about things that possibly require engineers and other people a multi-speciality approach and scientific approach to the problem. We are still sitting in the ages of where we want to insist that my boss or my seniors taught me this and I will insist on following that up. This is a new paradigm which requires a Google type approach, an Amazon type approach towards the problem, where you need scientists to figure out how to make us a state-of-the-art PPE. Our PPE, yes, comparing it to that of the 1918, the only difference is cloth and plastic. All right, there is no difference. Whereas we have got direct imaging of the brain to PET scans and whatnot, and 3 Tesla MRIs and brain mapping, because that was all developed by association with other researchers, including engineers and biomedical people. So this thing was never looked at properly, and if proper PPE technology would have been developed earlier, we could have actually protected our patients from even multi-drug resistant bugs like ESBLs, extended spectrum beta lactamase bugs. But those things require some sort of innovation. It is just the difference between Microsoft and Apple. Apple had the same platform, same machinery. It integrated the whole concept into an iPhone. Microsoft has tried again and again. It has not been able to do it because of the lack of vision of its leadership. So the lack of leadership vision in both, surprisingly, the Prime Minister of UK saying that he's willing to shake hands with COVID patients and then nearly dying from it, shows that we are not taking personal protection into a logical concept of solving it. So the future goes, if this thing persists and we don't get a vaccine in the next 6 to 8 months, then possibly we'll accept the fact of herd immunity, and therefore there will be no better PPEs coming out of China or the US right now. It seems they're not working on that front at all. So therefore we will be ending up with taking the risk of dying and just trying to survive. It'll be just a D-Day type, World War II type D-Day situation. And we'll solve it by dying, unfortunately. And then once we, and by that time a herd immunity will come in, and whoever has to die will die. That is what I feel is going to happen when we'll open up these lockdowns.
Yeah, I think
because I don't think, and there is very easily a solution of personalized PPE, which is like that of because I was in Houston, so I had visited NASA many times. It was just a logical place there where they experimented on things and they made it. You make a personalized PPE like that of the NASA people. There's a respirator, and the person, whoever goes from one room to the other, there is a shower type scenario which you make a plastic shower stands and you take a shower with that thing and you come out of it. And it's all waterproof. So therefore you stop cross infection, you protect your doctor in a very solid standardized manner, and probably that personalized PPE will cost you $2,000-3,000, but that if you add that up for the next 6 months, that much you are using on disposables. And make it of ceramic and glass, and the person can move around in it and have flexible things, and there's a change out room, and that's it. It's solved. When I used to sit at the University of Texas in Houston, the person who was in charge of infection control was the guy who was given the least amount of importance. So they were running the burns unit over there, and it was as though they just did not want to look into it, because all the decision makers are people who can't do good math, who don't want to design new things, who don't want to invent new things. So those people are only relying on this drug worked or this drug did not work, and those drugs are being developed by people who are pharmacists and other corporations. So in the end, physicians are end users and therefore will not have all the right answers. You need to have people who can think outside the box and who are actually engineers who can make aeroplanes and those sort of people. Not physicians making this decision. That's what I think.
Okay, thank you very much. So my second thought is that what can be the immediate steps jo hum le sakte hain so that hospital can be well equipped in Pakistan to prevent COVID-19?
Well, first of all, they should, this is what they are planning to do, and they are doing, there should be dedicated COVID-19 hospitals, government controlled, government funded primarily, because what is happening is that the rest of the population, people who have cancers, people who are supposed to have deliveries, people who have dialysis issues or other issues, people have broken ankles, bones, they should be able to come into a hospital that are only COVID, that are clean from those COVID patients. Because as you realize, the economy does not entail that our healthcare professionals, including doctors, can afford a lot of fancy things, number one. Number two, their inherent nature of the South Asian population is based on not keeping clean. So people breaking protocols and being careless is a routine affair even among senior people, and that's why you see that there is a spread of infection of a highly contagious thing.
Yeah.
So it's separating out hospitals would be the number one thing, which they are already doing. And screening. I mean, the other thing is, if you're going to do any elective surgery, someone needs a hysterectomy because they think the person has uterine cancer, then they need to get a COVID-19 PCR done 24 hours beforehand. Similarly, as technology comes in, possibly some sort of rapid testing point of care thing, if it's developed by people. But I think before that point of care will come, I think we will hopefully get a vaccine. Hopefully. You see, so therefore we might just get out of this issue. Otherwise, it's just you're playing Russian roulette, really.
Very
you
true.
are playing Russian roulette, because if New York can't handle it, then Karachi, even Aga Khan is currently having issues with their own staff members getting infected, because if I'm an Aga Khan graduate myself, the ICU that I see is not designed to be that of a COVID-19 ICU. I mean, if because you're in the pharma industry, I've experienced a little bit of pharma. I mean, having interlocking doors, epoxy, how you wear covers, all that is not happening anywhere. So, and the volume of patients that you have, you can't even do that.
No, you can't do that,
because so it's just not cost effective. So therefore, eventually it comes down to dollars and cents. That's why reusable PPE that you can wash. And have a full proper cover, like a respirator, like once they used to have those diving things earlier. That would be the real solution. But no one will invent it because you have not asked Elon Musk to do it.
Yeah, thank you.
Otherwise, it would be solved in probably 2 months. They would have those sort of PPEs.
Yes. So thank you. और मैं इसमें आपकी बात पे बिल्कुल agree करती हूँ. I was talking to a few of the colleagues, and it's very interesting. I was talking that we have to look into maybe GMP sort of arrangements, and also we need to look into very old school public health, जहाँ पे surveillance, vigilance, testing, quarantine. That's it, full stop. So anyways, with that, I have another question for you, जो कि आजकल बहुत ही hot topic है. How do we protect our frontline staff? क्योंकि ये एक बहुत बड़ा issue, media issue भी बना हुआ है, and many doctors and frontliners have been adversely affected, and they are the heroes at the moment. They are the saviors. So how do you see what steps can be taken with the current resources and situation? What can we do to protect them?
The best way for that most places are practicing are that first of all, you screen anyone who comes in with a temperature gun, give them hand sanitization, give the patient a mask when they enter. So the staff is wearing a mask, and the people who are doing this are wearing N95s and a whole overall, and getting it done so that they are protected while they are identifying these patients. Having a small 2 or 3 questions being asked, whether they have any fever or symptoms, and then assessing them in the ER if needed, or in the outpatient, having distancing, social distancing. Then cleaning out all surfaces, disinfecting all surfaces after an encounter in an outpatient service or after that session. So that is one process that you can do. Then elective cases, you have to decide to do COVID-19 screening before you go in. If it's an emergency, then trying to do surgeries in spinal rather than general anesthesia. For example, C-sections, doing them in spinal. So that reduces the incidence, even though the person is not symptomatic. And intubation creates a lot of spray of saliva and airway secretions, which can potentially infect you if the person is asymptomatic but is still infective. So that is the other strategy that you can use. And the anesthetist and everyone who's doing a procedure wearing an N95 mask while doing the procedure. So these are the techniques that you can use. But these are, as I said, suboptimal because of the fact that it's highly contagious. It can go up in the air and then stay in the air, and stay on so many surfaces. Now, go figure out why in the operation theater do they make instruments even right now with so many angles and nooks and crannies that you are wondering why the heck should it not be that more smoother. Even an Omeda anesthesia machine. By the way, the center that they made in UK for the COVID patients, this big center, Florence Nightingale Center,
Yeah,
I think.
yeah, that's
Yeah,
the one.
and you know, the beds that they were using, that were
Yeah,
fine, but the ventilators that they'd kept were actually anesthesia machines that they had probably gotten off an auction. So it was quite strange that how UK was handling it. I mean,
yeah,
it was also
yeah,
another lip service and visible and just eyewash, it felt. So that's why so many senior people got it.
very
They were
true.
not following protocols.
Yeah, yeah,
I mean, that's what it is. I mean, these are the things that might reduce the incidence, but in reality, I think the only institution that did well was in Italy. That a video of which I saw was they were wearing all these 3M proper
yes,
disposable covers with proper masks, not
yes,
N95s, and respirators. And those corridors of those hospitals were only for COVID only. No
yeah,
other technician, no food supply guy could get in there and come out.
yeah.
So basically, separate hospitals for COVID patients, and then waiting for herd immunity to develop or some vaccine to come through.
Thank you.
That's what it
So
is.
this is my last question with you. Can you shed some light on how do you see new normal will look like? What can be the practicalities in an environment like Pakistan?
Well, in Pakistan, the new normal will be back to status zero if the government was not doing a lockdown. Right now, I go out on a walk because I'm doing self-isolation and or social distancing. So I'm on the road to walk on the road because all parks are closed. So I noticed so many people going to the mosque for their prayers even during the lockdown in their car, and the whole family goes together. That's fine. It's because the markets, when you go to the markets, everyone is not doing social distancing. So unfortunately, the whole population is in a careless mode and thinks that it is. Some people think it's a joke, and I think the poor chief minister is still trying to show them statistics that it will go up and you'll be in
Yeah,
trouble, but then panic will ensure. So it will be basically chaos and confusion. That's what I see. uh, business wise, they will have to. I don't think restaurants can move forward with their business at this point in time, even in the US and
yeah,
UK and the rest of the world. So that model is gone. Home delivery type scenarios might work. Amazon is doing well. These type of industries will pop up and will continue to move forward. I think the rest of the cold surgeries will also go down, like cataract surgeries and lasers of the eye, etc., etc. So that's what it is. I mean, it will be sluggish as far as I understand. And if you get a vaccine, then I think 3-4 months later it will be back to normal.
yeah.
But otherwise, you know, the swine flu has already infected approximately, they estimate, 1.7 billion people.
Wow.
So my daughter got it, I got it, my brother got it. So the swine flu, and when I went to the hospital at that point in time to get the test done, so they said the kits were finished at that time too. That was Aga Khan. So I had to go to another lab to get it done. And at that time, when I asked everyone, they said all the ventilators are full. And I met a cardiac surgeon, and his mother was on a ventilator because she had gotten the swine flu. And out of those 1.7 billion people, 400,000 people died of the swine flu. So now I don't know what will be the mortality of the morbidity mortality of
Yeah,
corona,
yeah.
but I think the numbers are, I think, in a few million at least.
I
So
think so.
that's,
Yeah, because still we are behind having the true statistical figure from any part of the world. It's still building up, so we will not know until the whole of the chaos is settled somehow or another. So thank you
so
very
it's
much.
surprisingly every man for himself.
Yeah, that's I think how it's going to be. I think the thank you very much, Dr. Danish. Your talk was excellent. It was very insightful, and the messages I received from your talk is that protection and prevention will be the key to help the situation we are in, and obviously having the PPE will be very very
An
crucial.
advanced PPE developed by the
Absolutely,
defense industry or by some pharmaceutical industry,
absolutely.
not by doctors.
And the third message, which is very strongly coming from your talk, is collaboration of the expertise and creating some innovative models of working and producing innovative solutions to this situation. So absolutely excellent talk. Thank you very much for your insights.
Thank you for inviting. Thanks for
And yeah, hopefully we'll be talking with you again. Thank you very much, and
inviting.
have a safe day. Thank you.
You take care. Thank you.
Thank you very much. Thank you.